All right, range of motion is asked probably at least in two of your orthoneuro stations. Now you have 6 performances, right? So 2 of the 6 might start with range of motion. Probably at least 1 spine, cervical, thoracic, or lumbar, 1 spine station, and probably 1 extremity station. That would be about the right flavor of it. Now they may or may not do that. They might start 3 with range of motion. They could even start all of them with range of motion. So you do want to know it. But I will tell you this, they like to start with range of motion, which means that I want you to be really good at it. So let's talk about a couple of things. First of all, we think way back to your PT courses where you learn that physiological is active and passive, and then paraphysiological is where we adjust people. So realize that when we talk active, we're worried about muscle tendon problems. When we talk about passive, we're worried about ligamentous problems. Simple enough. Now, as we get down into the actual performance itself, one of the things that I want you to always be mindful of and kind of check mark it, box it, highlight it, is neutral is your friend. So no matter what we're doing, we're always going to stop back at neutral. We're always going to stop back at neutral. We're always going to stop back at neutral. We're always going to stop at neutral. Stop at neutral. So neutral is your friend. You get a little point for stopping at neutral each and every time. So you don't want to just rush through these. Some good news. You don't have to know any of these numbers. We just put the AMA numbers in here for the general adult. But you don't have to know the numbers. If you want to cross them off and squiggle them off, fine. But it was just to give you kind of a general idea. There was more flexion or more extension or more what at each joint. So don't worry about that. You also do not have to use an inclinometer, goniometer. There are no instrumentation. Some love notes, okay? Test active, aka voluntary range of motion, means all you have to do is active. So voluntary means active. Voluntary means active. Okay, always do it bilaterally. Now, the thing is, spine doctors, there's only 1 spine, so you're used to going right to where the pain is. But there are 2 shoulders, 2 knees, 2 hips, 2 elbows, 2 of everything else, and you always do the well side first when there's 2 of them. And that's where most of you foul it up. Okay, so well side first, well side first, well side first. Okay, and last but not least is, remember the purpose of this is to find the areas of pain or dysfunction. So you have to tell the patient that their job is to tell you if there's any pain or difficulty as they do this. So remember, you get a lot of points for telling the patient what their job is. They love to ask pretty much all of them. The only thing they've never asked are fingers and toes, and I don't imagine that they will. Okay, but you have to know wrist, elbow, knee, everything else. So, how do we begin this game? Now, let's bring Ben in here and we'll talk about how to do all these. Alright, now as we do the ranges of motion, the thing that's important is that you understand kind of the idea of how to do these. So I'm going to give you an example by doing cervical with Ben right here, right now. So if I say, Benjamin, your job is to tell me if there's any pain or difficulty when we do these. He's young, he's healthy, he's probably not going to have any, but if he's play acting, he might have to come up with an ow somewhere. So we won't worry about the ow at this very minute, but I want you to sit up straight. Okay, no, you're going to stand. Just sit up straight. And then the job is to tell him to do what I do. So I want you to flex your chin to your chest and tell me if there's any pain or difficulty. Okay, any pain or problems? He'll say no. Okay, I want you to lean your head back. Okay, and then back to neutral. Okay, now I want you to lean your head towards one shoulder. Okay, back to neutral. And then towards the other. Any pain or problems? Okay, now just like me, I want you to hold your shoulders still, but I want you to rotate over one shoulder as far as you can. So turn your head. Okay, and now back to neutral. And then the other way. So that's how we're going to process this with the patient. Now, what if they say, instead of doing voluntary or active range of motion, do range of motion of the cervicals? Now that's different. That means we have to do active and passive, which means our instructions are slightly different. So you've got to practice both of these or you're not going to be ready. So I want you to flex your chin to your chest and tell me if there's any pain or problem. Hold it there. If he says no, then we're going to press slightly. Now the thing about pressing slightly, I just barely pushed on him. I don't want you pushing hard on each other, but what I want you to do is experiment with this. When you put somebody in this position, look at what's going to happen if you don't stabilize. So if you'll notice, I almost naturally put my hand on his shoulder to stop him from moving forward. Okay, so I want you to look at where's the right place to stabilize somebody so you're not knocking him over, tipping him over. Because when he leans himself to that side, no, I'm sorry, just your head. So he's tilting this way. If I'm going to push him, I'm going to put my hand on this shoulder. So hence we see that motion. So I want you to process through every single one of these thinking where's the logical place for me to place my hands. Now, one thing that's kind of important, I think, in spinal ones is to cross the hands like this. If you'll cross your hands like this, go ahead and tuck your chin to your chest, then I can place my hands right here, and then I'm not ever touching breast tissue or getting into somebody's personal space. It's probably the best place to do that. Go ahead and look up again. So that's my recommendation for cervicals. Now let's take care of just the rest of the spinal ones. So if you look over here, we've got lumbar, we've got thoracolumbar. I'm going to show you lumbar range of motion. Flexion, extension, lateral bending, and rotation. I'm now going to show you thoracolumbar range of motion. Flexion, extension, lateral bending, rotation. I'm now going to show you thoraco range of motion. Flexion. Are you catching on to this? They're all the same. So we're not going to be bending forward, eliminating the lumbars, just doing the thoracic. You don't have to do any of that. All you have to do is take somebody through flexion, extension, lateral bending, and rotation. But let me make a couple of suggestions. So stand up here and face our camera for us for a second. Cross your arms like this. Okay, if I have him flex forward, okay, and ask him if there's any difficulty for lumbar, thoracolumbar, or thoraco, and I have to push him, I'm going to push just slightly down. Does everybody see that? Okay, now if I have him lean back, where am I going to push? And that's why those arms are crossed. And it's probably a good idea to slide one hand back here to the pelvis and do that way. So at least it looks like you're bracing and holding your patient, but I'm not pushing hard. When I rotate him, rotate that way, probably I will do this. Okay, so one hand on the pelvis, one hand pushing this way. Okay, so I want you to work your way through this as I have him laterally flex. Is it obvious to you that I've got to have a hand down here on the pelvis as I push him this way? So I want you to work your way through that and see where you're going to stand in position and make sure it doesn't look like you're going to touch anything you shouldn't be touching, because we can lose all the points in that room. All right, now go ahead and have a seat. So that takes care of the spine. Now when we talk about cervical, thoracic, or lumbar and spinal mechanics, you go right to that area and you test it. But now let's start with shoulder. You walk into a room, you have to do shoulder range of motion, so you know you have to do active and passive, so it's going to take some time. So the first thing you do is say, hey, where's it hurt? And I tell you this shoulder, and you start having me move it. Wrong. So if you tell me it's this shoulder, I tell you it's this shoulder, then realize you have to do range of motion on that shoulder. Now there are a couple ways you can do this. You can do this, and then do this. You can do this, and do that. Or you can do all of them on this arm, okay? And then do this arm. So you can decide if you're going to do one for one, for one, for one, or do all of them and then do all of them. That'll be up to you. Either one is appropriate. It's your call. But I want to talk to you about the right position. Standing. If someone is seated and you say, I want you to do this, where does his hand have to? See where your hand's starting? Where does his hand have to start? On the table. See, and then raise it all the way up, and then let it down, and he hits the table again. So I don't want you to do range of motion for the shoulder seated, and a lot of you try to do that. Don't do that. So two things for shoulder: standing and well side. Standing, well side. Okay, so let's have you stand up. Okay, face our camera. Get over here where I can see if we're not going to hit this now anymore. Yeah, I'm trying to get that out of your way. I think it will. You got kind of long arms. Okay, so then you might want to stand and face your patient, but I'm going to be off to the side so that you can see what Benjamin's doing. But I want you to raise your hand up like this and tell me if there's any pain or difficulty. So he'll raise up the side that's not hurting and then bring it down. Now, if I have to do the full range of motion, bring it all the way up, any pain or difficulty, now my job is to push on that and I can push him over, right? So again, we've got to stabilize on the other side. So again, I want you practicing these. All right, now for adduction, abduction and adduction. Adduction, we're going to have him put his arm straight out like this and try to cross his body. So he's going to try to come across his body, and then we do a gentle squeeze. So adduction is done out here because of breast tissue. So some women will have too much breast tissue to come across down here, so we just do it up here for everyone. All right, now the next one I want you to do is I want you to do flexion, and then we're going to do extension. So flexion first, just bring it all the way up. Again, I might have to push back if it's full range of motion. Now here's the thing I don't want you to do. Flex your arm like this, Ben. Okay, now try to raise it up with it, nice and tight and flexed. You see how he can raise it up like that, but look at me, I can't. But if my arm's straight, I can. So when you're young and able, you have a lot more range of motion than the older patient, so you get true range of motion of somebody if the arm is straight. Don't bend the elbow. Okay, so bring your arm all the way up. Okay, again, if I'm supposed to test it that way, fine. If they just ask for voluntary range of motion, I don't do that. Bring it down. Any pain or problem? Now, you've got to step forward. You're going to hit the screen. Now, bring it back as far as you can. Okay, again, now in this one, you may stabilize here and bring it up like this. Okay, so there's your extension. Now, let's talk about rotation. Rotation, the neutral position is like this. Okay, so hold your arm like that. Okay, then you're going to try to open it up like this. Okay, so then I would stress it this way. Okay, now put it back to neutral. Now you're going to bring it down like this, and then I stress it this way. So you see how he's trying to even add some more there. Cut it out. Okay, so we don't have near as much of that. So external and internal rotation then are done with this neutral. So let's think about the neutrals then. Hanging at your side is neutral for most of them. But what's adduction neutral? Here. Bring it across the body, right? Okay, what was rotation neutral? Here. External, internal. Okay, so make sure you practice these so that you know your ranges of motion, their proper positioning, and where the neutral is. Alright, our next one up here is elbow. Here's where you get into trouble with elbow. Most of you are pretty good that it flexes. Okay? Standing's the best place so you're not hitting the table again. So really, when in doubt, have the patient stand up. You can do the cervical standing. That way, do them all standing and then you don't mess up, with the exception of the hip and the knee. So we'll talk about this. Now the elbow flexes and extends. Now some of you will say, okay, I want you to flex it up and tell me if there's any problem, then you just quit. But you have to have the patient force it into extension, lock out your elbow, because you need to know if the triceps hurt or the olecranon hurts or there's a bursitis back there. So even though there's 0 to 5 degrees, you still have to attempt it to force it into that motion. So we do flexion and extension. The next thing I want you to do is do this, just like I do it, thumb up. Now he's going to point his thumb out like he's hitchhiking as far as he can, and then he's going to go back to neutral and point it in. So what did we just test, everybody? Pronation and supination. But if you'll notice, I didn't say those words, and you don't have to either. You can talk patient ease. You don't have to talk doctor ease to your patient. In fact, sometimes when you say words like pronation and supination, your patient's going to look at you and go, well, what do you want? Okay, so you don't want that ugly look. So I want you to make sure that you tell the patient, point your thumb out, point your thumb in. Practice your patient language. All right, supination, pronation. What are you going to do, man? I don't know. Okay, all right.